Hi, we are here today at the Eye Clinic London with Dr. Samer Hamada.
Welcome.
Hello,
Hello.
I'm very excited today because we are going to talk about eye health. So please, Dr. Samer, tell us how did you came to ophthalmologist?
Oh, interesting. Well, to be honest, my interest in ophthalmology started by my interest in looking at the body inside. And I want something where I can do medicine and surgery same time. And the only specialty I could see that you can do both at this high level is ophthalmology. And that's why the whole journey started.
Fantastic. And I've been doing some research, and not many people know that eyes are very important, and you can see the inflammation of the body just by looking at the eye.
Exactly.
So the eyes are not only the window of our soul, but also of our overall body health.
Exactly.
Is this correct?
That's very, very correct. So to be honest, as you said, the eye is our window to the world, but it's for me as a specialist, for professionals, is the way we look at you inside you and know what's going on inside the eye, in the body itself. So as you mentioned, touch on the inflammation is one of the things that we look at. So I'll just give you example. If you have inflammation anywhere in the body, so in your gut, in your skin, in joints, any autoimmune disease, a lot of time is manifest in the eye. So you can pick up signs of inflammation by looking at the eye. And a lot of eye diseases, systemic diseases, can be picked up by looking at the signs in the eye. And that's
What
why
signs?
when patient complain about eye problem, eye symptoms, we encourage them to come to have a checkup. Why? Because often we pick up signs indicate there is another underlying cause of their diseases. For example, someone complain about vision fluctuating from time to time, right? That could be sign of diabetes. When you look at their natural lens, you see the color change, natural lens. We look at the retina, you might find some changes in the blood vessels. So remember, the eye is the only part of the body where you can see blood vessels with naked eye. You don't need any equipment, anything.
Oh, wow. I
And you
didn't know
can
that.
tell the status of the blood vessels.
Fantastic.
It is.
And is there any, for example, any food that we eat that can influence the eye health?
Of course. So look, the eye is not like isolated part of the body. So if whatever you eat, it reflects in your health and reflect in your eye health. So there are a few things that your body cannot make, your eyes need it. So for example, some of the vitamins, the omega-3, we need omega-3 for eye health, less eye inflammation. These kind of essential fatty acids you need to eat, nutrients to your body. You need to have anything that your body cannot make, but anything that can help you to maintain high oxygen level and maintain high health to the eye itself.
Would you tell us a few food? Because I remember my grandmother always would say, eat some carrots
Yes.
because they're very, very good for
Yes.
your eye health.
Yes, yeah.
Is that the truth? Is there like some specific foods or that can be linked to eye health?
Of course. So you've got stuff that help the oily layer of the tear film to lubricate our eyes. We don't get dry eyes. And this is what I mentioned earlier. It's you got omega-3 and vitamin A. And these things you can find it in cod liver oil, flaxseed oil, seeds. All that can give you source of omegas, especially 3 and also omega-7. There are things that you need as antioxidants. So anything green, green leaves, green vegetables, colored vegetables, very good for our health, for the retina. So there are a lot of lutein and zinc also needed for the healthiness of the retina. So generally speaking, our eyes needs a lot of oil, needs a lot of vegetables, antioxidants, and needs some vitamins, vitamin A and vitamin D.
Can sugar be damaging the eye somehow?
Of course, yes. So, high sugar means you might have a diabetes, right? And diabetes is one of the causes of blindness because you can have diabetic retinopathy, which is effect of the damage of blood vessels in the back of the eye, meaning you have a bleeding in the retina loses its function, and that leads to blindness. Luckily, it's one of the kind of condition where you can control and you can slow the progress or prevent, exactly. So yes, this is where one of the things that the blood sugar can affect your eyes, but there's more to that. So for example, blood sugar can affect your natural lens and can make changes in natural lens. So some patient with diabetes, they complain that their vision, especially at nighttime, start to change, or their vision change when the blood sugar fluctuate, and that usually because the natural lens itself it changes its clarity and its refractive index.
Oh, fantastic. I always thought that why diabetic people become blind is also for the medicine that they take. Is that correct? Or is just related to the illness
No,
itself?
to be honest, what upset the retina the most is the fluctuation in blood sugar. That is more damaging that you're having high all the time or low all the time. And that's why constant control of blood sugar is the key thing in maintaining your health of the retina.
Not only on your body, but also on your eye.
Exactly. So that is where people really have to stick to either with a diet or taking their insulin or whatever anti-diabetes treatment. Consistent, good figure of blood sugar is what matters here all the way through. Now, anything that to play with that control, if you like, whether current treatment, or more Ozempic treatment, a GLP-1 receptors agonist, all that can actually accelerate the changes in the retina and can lead to worsening of diabetic retinopathy.
So you just mentioned GLP-1 peptides, and many people are taking that not for a diabetic reason, but more for blood sugar control and to lose weight. So GLP-1, many people take it as an injection to lose weight. These GLP-1 peptides, they have many names. Are they harmful for the eye health?
Well, look, when its license was for people who's diabetic, for people who have a high BMI, for 30 plus or 27 with other comorbidities, they're not licensed to lose weight just for body shaping, for example, right? But unfortunately, with increased use outside the license, we start to see more and more problems. And remember, the use of it now is very, very wide. And in our clinics, we start to see patients come. We ask them what's going on in the background, and they start suddenly complaining about dry eyes. They start to complain their eyes feel uncomfortable, irritated. They're getting more tired. And that suddenly when we try to say the link, we start to see there's more link between patient on the GLP-1 and the dry eyes. Now, we're doing more and more studies now to try to see at the association. Remember, this is early days, 3-4 years. There's not enough data to talk about the effect of this kind of treatment on the eye itself. We know there are not reports now. It's established that 30% of patients with diabetic retinopathy can get worse by taking the Ozempic or GLP-1. And this is something people need to be careful about. So my advice, anyone going for the kind of treatment, is to go for eye health assessment to check their eyes. Are they vulnerable to have dry eyes? Do they have any issue with the retina? So you make an optic nerve. There's a lot of cases of optic neuritis as well. So it's really, really important to think about, it's not just I'm talking about something to lose weight, but what's the side effects about me? Especially a lot of patients can be younger patients. They might have some underlying condition, they know about it. So that's why eye health check is really important.
But in a way, it can be very good because, as you say, control the blood sugar level.
Yes.
So, these people, if you take GLP-1 peptides, it may control the blood sugar level, so then the eyes get healthier as well.
As you say, it's amazing drug, no question about it. But because it's still early stages, I think there's not enough information about side effects. We pick up these sorts of things. People talk about dry eye, dry mouth, a lot of things.
Course.
And that's why I think it's great to use it as long within the license, it's monitored and all that, but also you have your eye checked before start treatment, and if there's any consequences, to keep your eye checked. I think that way, prevention always better than treating when it's too late.
Of course. Yeah. So our advice is if you're thinking or taking GLP-1 peptides, to have an eye health check in the way, where you started, and then you check again after you take the drug. So you keep checking your body, because at some point you may don't need it anymore.
If you ask me why people go for that, people look for longevity, right?
Yes.
So people like to say, okay, I want to look younger, feel healthier, better, delay any aging process, which is fine. But remember, when you talk about side effects, I'm worried about it's cause you more trouble, make your eyes age more than your body, right? That's one thing. And when we talk about aging, we remember we had a chat the other day about how does the eye show the signs of aging as early as we're young, 30, 35?
Because actually, even in aesthetic, the first thing that lose vitality is actually the eye. And even if you can lose vitality also on the inside eye, if you're sad.
That's right. Let me tell you, start by, if you look at someone and you find they lost that sparkle in their eyes, they have more dark skin, they have a really look like tired eyes, you know they're aging, right? That's very early sign. And the eyes, human eyes, so catching, so you can capture those signs very early. You don't have to be a doctor or professional. You can say, this person look tired. And how do you know? By look at their eyes.
Yeah, and sometimes they are a bit like yellow. They are not that bright. They are not that white. And you're like, even by looking at that, you see that there is maybe a gut problem or something inside that it's not quite right.
Correct. So if you think about from front to the back of the skin around the eye, it's a very, very thin skin. So it's less than 0.5 millimeter thickness, meaning that it shows any signs of swelling, puffiness around the eyelid, dark circle when circulation around the eye is not good, more puffed eyelids when the lymph and drainage system is not working well. All these signs of tired eyes, okay? When you look at the eye itself, remember, inflammation equal aging. So when you have a start of inflammation, you're losing your longevity, your youth. And inflammation means that the gland become inflamed, so you don't have enough oil produced to lubricate the eye. So you lose that shiny, sparkle look on the eye because the eye is dry. And now with people with the lifestyle, whether you have like working from computers, using your eyes a lot, digital eye strain, or even intensing something inside you in your gut. You mentioned the gut, we'll talk about it in a second. So all that can lead to the eyes to look like aging quickly because there's inflammation, whether from the environment around us or coming from inside us. That end up being that organ, the end organ, which is the eye, that need a lot of oxygen, need a lot of lubrication, nutrition, become aging so quickly, and it shows straight away. If you address those, you set a patient to feel and look younger.
Yeah, of course. And so if you look at the eye and it's tired or inflamed, what is the first sign? Loss of brightness?
Lose of brightness.
Maybe it's like smaller.
Yeah, when you look at the person, first of all, you look at the skin. And as I said, the skin looks tired, right? You can see that their skin look dull. They have dark circles, they have puffy lids. When you look at the eye itself, you might see some yellow patches on the white of the eye. You might see that the shine of the cornea is not the same. That's all tells you. You find even when they try to blink, they're tired. So all the tired eyes. Now this is from what you see. These are the signs. But the symptom, and this is just from exterior without examining the eye. Patient come with symptoms. So patients start to say, my eyes feel tired. I never felt that tired so much. Feel dry, feel gritty, feel burning sensation. I feel I cannot go out without my sunglasses. So all the things tell you that actually their eyes start to suffer, start to struggle. And this is when we need attention.
What I like about your approach that you look at the eye not only from a scientific point of view, but from an emotional point of view as well.
Yes.
And I think this is really important. And not many doctors do that.
Yeah.
So how did you came to that approach?
To be honest, when we started doing the dry eye clinic here, which I started around 2015, 2016, we set up the first dry eye clinic in London. I said, look, start to see patients and get more tools to diagnose, tools to treat. The first thing I noticed that these patients have a lot of some change in their lifestyle. Could be something physical, could be mental change. And I start questioning. So we start to having this long questionnaire, asking patients about their lifestyle. And patients sometimes question, why are you asking about what I eat, what I drink, what in my mental health, exactly, my lifestyle. And then you come to see that actually a lot of patients have some stress in their life. Something brought symptoms, make it worse. And it's not unusual. We know now there is something called the brain-gut-eye axis. So your emotional status affects your gut. And in the gut, you've got your regulation of hormone release, your regulation of metabolic cycles, and autoimmune relegation around the eyes that induce inflammation.
But also emotion, because like I have a gut feeling, or maybe I cannot eat because I'm stressed, or I eat too much.
Yes, exactly. That all that as a result cause you inflammation in the eyes, and then it all started. So when they come to you, I say inflammation in the eye because the eyes feel uncomfortable, tired, dry, and all that. Rather than just focus just on the eye, I need to know why this happened. Why suddenly someone live a happy life, enjoying everything they find, suddenly their eyes become a problem in their life. You start to think and you look back what happened, you can't find a lot of times underlying condition. As I said, could be something to do with their stress, with their lifestyle. And that's why the treatment here is not about give you drops to treat dry eye. I want to look at how can I make you better person,
So
and how can I improve your longevity. I call it eye longevity, if you like, yeah.
Of course. And have you ever had a patient who came and say, I don't know, my eyes feel tired, and you're like, oh, but this patient has got nothing. And by looking at their way that they live their life, or from the food point or from a screen point of view, like from work they do, you just say, actually, you have nothing on your, you have no problem with your eye, but the problem is because you are looking at the screen too much, or you are not eating too much antioxidant.
I'll give you the example, which is classical example, where what affect our eyes is not just the environment around us, is us. What happened inside us.
Oh, I love that.
The
So it's not what it is around us,
what's
but
inside us.
what is inside us that
Exactly.
can affect your eye. Very
Exactly.
good.
And your eyes under influence of hormones, under influence of the nerve system, under influence of the autoimmune regulation, all that affect the eye surface. Now, the classical example, as I was saying, this is female toward age 45 plus, wearing contact lenses. This, we all are now in digital world, so you're using your eyes at least 8 hours a day, exhaust on screens, phone, all that. You wearing contact lens, irritate the eye. This is like rubbing the eye surface all the time. I said
We should not rub the eye,
exactly.
right?
The hormones changes at age 45 plus. And finally, you're putting makeup as well on top of that. That classical 4-5 items exhaust the eyes because the eyes become now very stressed. That stress is external stress, is internal stress from your hormones, from the environment, the computer screen, the environment around you, the sun, your makeup you're putting, the food you're eating, all that become one thing. Unfortunately, we forget that whatever you eat, drink, it all affects your eyes. What you do in your day from the minute you wake up to the minute to sleep affect your eyes. How many hours you sleep, your cycles, sleeping cycles affect your eyes. So this is all multifactorial affecting our eyes.
Dr. Samer, so we spend long hours at the screen because we are always on the mobile phone, and not only for work but also for social media or checking WhatsApp, or we are spending long hours in the screen, or we watch Netflix. I don't know.
Course, yeah,
So
yeah.
is that something that influence the eye health?
Of course. So there's two things. There's the light itself, right? So if we talk about simple thing from the sunshine, UV light affect damage our eyes, damage our surface of the eye, damage our natural lens, damage our retina. So sunblock, eyeglass, sunglasses, very, very important to protect your eyes. But also as you're talking about the blue light. This is the screens. This is the watching TV, watching screens, watching your phone. The blue light is a light with high energy. Actually, it stops us from sleeping.
That's why they say also don't look at your screen before you go to sleep.
Exactly.
Or if you want to fall
At least
asleep.
an hour or two before you sleep, you should not have look at screens. But daytime as well, bright light exhausts the eyes because it's cause we need bright
But
light.
it's also very
We need-
healthy.
we
I
need-
love the light
yeah,
in
we
the
need a
morning
bright
because it
light.
gives me
Yeah,
dopamine, you
of
know,
course, yeah.
release of good hormone, make me happy.
Cortisol release with the bright light. That's why in offices they have this bright light because they
Yeah.
have more emotional effects, they give you that energy. You
Yeah,
want to work.
keeps you awake.
So that cortisol kick in, you give you awake. When you're at home or you want to relax, you need what? Cool lights. You need warm lights because
Soft.
that a soft light because that again relax. The colors itself affect our mood, right? So you got some colors are relaxing, green. That's why we need to connect with nature. Unfortunately, we're not out all the time now. We're getting more indoors. We not look at the green. That calming effect from the green light is not there. Blue light give you that feel of sustainability, steadiness, strong, looking at the sky, looking at the sea. That also calming effect. We don't do that. So the colors also affect our eyes, affect our mood, and affect our hormonal changes as well.
Oh, fantastic. And you talk about makeup.
Oh, yes.
So I think this is very important, especially for our female audience, but
Yeah.
also male
Yeah.
audience, because some of them they use it as well. So is makeup good for us, bad for us? I want to understand if putting mascara
Mm-hmm.
is the same as putting eyelashes extension. Removing makeup is also good, not only for skin health, but for eye health.
Yes. So let's start to say, first of all, what live on our skin, on our eyelashes, on our lid margin, eyelids, it's combination of bacteria, various bugs, viruses. It's called the microbiome. It's the flora. This is natural inhabitant of our skin.
Because bacteria
It's
are
a
good
good
for
bacteria.
us.
This is
Exactly.
exactly. So bacteria and some viruses are very good for the skin. It's help you. We need them, right? Now, second thing, when you put a makeup, these are all chemicals. It's sitting around the eye, and then it's inevitable that some particles will leak into the eye itself, the mainstream. So your tear film will be floating with all these chemicals. So you're really insulting your eyes when you put a makeup. So there's nothing 100%
We
correct.
insult the
There is
eye.
insulting the eye. There's no 100% good, 100% bad. There is some good, some stuff, which means
But we
that
look so pretty when we put.
that's why I said we love to have makeups, right? That is just the habit, what to do. So first of all, for example, you need to avoid putting the makeup on the waterline inside the eye. I think that is not a
Yes,
good
I
idea.
heard that.
Because
So put the pencil under the eye, not inside the
correct.
eye.
Because when you put inside the eye, you're blocking the opening of those oily glands that produce the oil. So you actually make it worse. Two, the makeup itself will affect your flora, the microbiome, we talked about it, right? So you're gonna get overgrowth of those bad guys, bad bacteria, bad demodex might start to become effective, meaning that the eye become inflamed. That doesn't help. And the third thing, when you do your mascara, for example, talk about mascara, you reinfest yourself because you wiping all this bad stuff, put it in that beautiful nutrient cultural media for the bacteria, then you apply it back again to your eye. So we reinfest itself. So when you do those mascara, always advise to change it frequently, use a small volume, reusable. Exactly, if that'd be amazing. This kind of things. And the third thing, remember, because the products makeup has a lot of pro-inflammatory products, that means you're inciting inflammation inside the eye all the time. So the more you put makeup, the more your eyes become inflamed. That's why people say my eyes always red, inflamed. Plus, you expose yourself to, you know how many chemicals in each of those products? Tens of chemicals. So naturally, you want some reaction, irritation from some products that irritate the eye. So it's not just about affecting the microbiome, you're causing some inflammatory reaction, allergic reaction to those chemicals and all that. So the key here is, when you do makeup, do it nice, but clean it nicely. Clean it thoroughly.
Okay.
And when you use cleaning it, use special wipes, eyelid wipes, which actually get rid of all this bad bacteria that's growing over the time. And that's,
But wait, because wipes are not good for the skin. Actually, if you speak with dermatologists, they say not to use the wipes.
Yes.
So maybe we can use some foaming cleanser, especially for the
there
eye.
are two types. You're right. There's two types. There are the wipes and there's a foam. Some patients find the wipes, as you said, irritating, but I'm talking about cleaning the eyelashes roots. That is where actually the pocket of all the bad bacteria. So it could be a combination. You can use a foam and you can use wipes or just cotton bud just to clean the eyelashes roots. The idea is the eyelashes roots is where all things happen. All the bad bacteria sitting, accumulating around the eyelashes roots. So the good thorough cleaning, just once a day, once you finish day, or if you do twice, it's even better. But that ensures that you have the natural bacteria help you to maintain your eye health.
Okay, so if you put mascara, make sure you take it off and really pay attention on removing it around the eyelashes, right?
Exactly.
And what about eyelashes extension? Because you apply once a month, okay, you put the glue, but then you're not there removing the cap or putting makeup.
Yeah.
And do you think is as bad, is healthier, is the same?
Again, it's the same story. Look, anything you put around the eye, whether you're putting just glue eyelashes or you're doing tattooing and all that, all these are foreign bodies, foreign material, plus chemicals. It can affect your eyes, either affecting as a foreign materials or cause reaction, cause inflammation, give you. So when you put it in, the first thing happen is you inducing inflammation. Patient comes say, my eyes get red twice after doing those eyelash extension.
But not everybody's like
Not
this.
everyone, yeah. This is from various person to person. It's always good to find a product where actually it's the least irritating the eye. The type of glue used is one of those benign ones, the simple ones, not too complex. Because it's inevitable, some patient will have some reaction and can have inflammation.
So
And
I
they are-
think the key is also to understand what suits you, because
Yes.
for some people maybe eyelash extension
Yeah.
are good and they are not a problem, but for others they can create inflammation and reaction.
Correct. But let me tell you something, Francesca, here is when we talk about enhancement of eyelashes, this is not just about adding fake eyelashes. You have to think about why the eyelash is not healthy. There could be some underlying condition. Inflammation itself, you're losing your eyelashes a lot. They don't grow length enough. So if you address that problem, then your eyelashes grow better and you feel like, oh my God, I have a more healthy eyelashes now.
I understand, but
Exactly.
it's for some people it's not about not growing the eyelashes. It's more about I don't wear so like this. I don't have to wear makeup, and I
Yes.
look always fresh.
Yes, yeah. It's also a
So-
good idea is to have your eyes checked before you have those eyelash extension, because quite often, even though you said that a lot of patients have the eyelashes, people not patients, have all the eyelashes, and they're fine, right? They don't have
Yeah.
issue with it, but there might be underlying condition because not often, not always actually, the inflammation will give you signs. You could be actually just I'm fine, I'm doing that, and then at some point things start to trigger and start the inflammation kick in, and you start to find symptoms upsetting your eyes. But that because you've been for a while, that insult from the eyelashes all the time really causing little by little inflammation, damaging your meibomian glands. We talked about the other day. Meibomian glands, right?
It sounds very
These-
kinky.
Those are a little glands, 20 to 30 glands in each eye that produce the oil.
Okay.
And they don't come back. If you lost them, you lost them. And they're
That's
very
it.
precious. That's it. And they're very precious glands. So that's always we encourage people, examine your eyes, check what those glands looks like.
What's
Because
it called again?
meibomian glands.
Meibomian glands.
And actually,
Don't lose it.
Yeah, don't lose it. MGD, which meibomian gland dysfunction, MGD is very common, especially in the current digital age where we use computers a lot. We don't blink enough, right?
And what about eyelash serum? You know, the one that make your eyelash grow.
Yeah. Well, I don't. To be honest, in my clinic, we see a lot of not so good stories, let's say the least, because patients come back and react to those serum, and they tried once and the second and the third product. Unfortunately, not many products are great in terms of what's in it, because remember, to enhance the growth of the eyelashes, you need to use sometimes prostaglandins. Prostaglandins feed in the inflammation to make your eye inflamed. They have one good thing, make the eyelashes darker and stronger and longer, but actually it feeds into the inflammation. So it's a bit of balance of, look, if you always try to maintain good eye health, generally speaking, then actually you're more resilient. You can have eyelashes, you can have a nice makeup, you can have a lot of things, but your eyes are strong enough to resist any bad inflammation. If you are, as a person, healthy, what I mean by healthy, because people think about longevity, because I sleep well. Your eyes need you to sleep well.
Yes.
Your eyes need you to eat well and to drink well. Your eyes need you to have a healthy gut. So all that is feed into one thing, is your eye health. And that's why if you maintain good eye health, good body health as well, you can do all the things, enjoy life without have to suffer or struggle with the consequences. Yeah.
And is it good to use sunglasses to protect your eye?
Okay, right. So if you tell me some small tips would help our eyes, I tell you that we are today different from 20 years ago, right? Because now we are really in the environment different. We exposed to the sun different way. The UV light is high concentration. We use computers, we exhaust your eyes. We eat all kind of food now, we don't know what's going on, right? There's a lot of processed food. We actually harming our body. So some tips to protect our body from that harm around us is one, as you said, sunglasses. Even where there's no bright sunshine, still you need to protect your eyes because UV light concentration is high. UVA and B can damage the eye, so you need to be careful. So yes, wearing sunglasses is very important. And now we're coming to season where they're gonna be sunny, so it's very
Yay.
important. Yeah, exactly, yeah. 2, look after your sleep, like you think of it as treating your eyes. If you sleep well, your cycle is better, your cortisol regulation is better. You stop using those screens an hour or two before you go to bed. Eat well, look after eating nutrients that needed in your eyes, right? Especially vitamin A, vitamin omega-3, vitamin D, all these are very important. Omega-3 and 7 actually in particular are very good for the eyes, right? And then antioxidants is very good for the natural lens to delay cataract formation, to delay macular degeneration. Zinc, lutein are very important for our eye health. So if you have everything in balance, we're fine. Unfortunately, there are things that you can't get from natural resources. No matter how much you sit in the sun, you're not never going to get enough vitamin D, for example.
So we need to update that.
Exactly. We don't eat oily fish all the time, so you need supplement of omega-3. Yeah. Even if you eat 3 times a week, it's still not enough. So omega-3 supplement is really good. Omega-7 supplement.
And drink olive oil.
Oh my gosh, yeah. Instead of wine, just olive oil.
Exactly. Much better. Does wine influence the eye health? Because wine is not good, as we know, for our body.
Well, if you don't have a dry eyes, you're probably fine. Obviously, everything in moderation we talk about now. If you're average drinker, you have a healthy eyes, you're fine. But if you have a dry eyes, it makes your eye much worse, and that's very important. So people know about it. So people who drink, they tell you that my eyes actually next day feel more dry.
Yeah, and also they say the burn. Some people, have a hangover, and they also say my eyes are burning.
Tired, yeah. Look, these small things actually tells you that actually you have some underlying condition. You're borderline to dry eye. And that means that actually you have to check your eyes check as well, because you could flip into a dry eye condition. Dry eye condition, when started, drops is not going to be the answer. And it can be really affecting the quality of life. I'll give you an example. Patient come with a dry eye. They complain about fluctuation in vision. They said, I don't like it. I don't enjoy what I'm doing now because my vision keep fluctuating. I want to enjoy that trip or whatever. My eyes one day good, one day is bad, fluctuate from day to day. Evening, I can drive very well. So vision fluctuation on top of the symptoms of the gritty, burning eyes really can change the quality of life. That's why we talk about, again, of eye longevity.
I understand.
Detect early signs of aging in the eye early to protect your eyes, live longer. Because the aging starts with inflammation, start with the eye first.
Very good. One more question, last one. Does sex influence your eye? Ooh. Having a healthy sexual life?
I don't think that's studied very well.
I'm sure you have your knowledge.
Yeah. No, to be honest, look, anything improve your circulation, obviously will affect your eyes in a better way. So I think if any effect is going to be positive effect.
And also you will get the sparkle back maybe, right?
Of course, yeah. You need eyes to see, right?
Exactly. I love that today I came to speak about eye health, and we actually spoke about also makeup and emotion. And I think this is what the future of doctors should be about, not just only looking at the science of the symptoms, but everything else.
Yeah, we don't want to treat science. We don't want medicine. We want to look after your body, reset your body, make it better, more resilient, stopping all these aging changes at early stage.
Because age is just an illness, so we can cure it.
That's true.
Thank you, Dr.
Thank
Samer.
you so much.
I loved this conversation, and I'm sure we'll see you soon.
See you soon.